Welcome back to Detroit Wants to Know. One of the other areas that WalletHub.com looked in when rating Detroit the worst big city in America was access to health care. Well, this week there was an amazing conference in Detroit that had over 4,000 doctors. And I have three of my favorite doctors here. I have Dr. Lonnie Joe. Welcome.
Thank you, Steve.
I have Velva Clark, not a doctor, but part of the RN, part of the auxiliary, and Dr. Jeffery Clark. Velva, I want to start with you. How many people did you really have attend this conference that was in Detroit? It was the NMA conference?
Yes, the National Medical Association is an organization of African American physicians and their spouses. I was the president of the auxiliary to the National Medical Association. And with the 4,800, we had about
4,800.
4,800 total for the convention, I believe. We had approximately 1,000 wives. And we do programming for the spouses, and we also had a community outreach component this year.
That's awesome. Dr. Clark, tricked you up there for a second. Dr. Joe said to me off camera that you had all of the Surgeon Generals here the previous year?
Yes.
Tell me about that. Was that moving or what?
It was very moving, and it was a very inspirational event. It started with a reception at the Museum of African American History with a lot of the members from the National Medical Association and a lot of the leadership from here in the city, and it was a very inspiring event. And then it went into two morning sessions where the Surgeon Generals were able to address issues that the members brought to their attention.
Dr. Joe, you all also had you had multiple types of screenings, prostate screenings. What else did you have?
Yes, we did. We screened men who would show up just with identification alone, no insurance involved, nothing but the ability to identify who you are, and it was totally free. We did the prostate rectal exam as well as the prostate blood test free of charge.
Was that before the lights went out at the Renaissance Center or after?
Well, it started on Saturday morning, so it was before the lights went out.
Thought I'd ask.
And continued through Tuesday, and screened a lot of men. A lot of men attending the convention and a lot of men off the street. And in an effort to continue to try to identify prostate cancer in men of all ages, a disease that we should not have to die from, because if we can detect it early, we certainly can treat it. And it went very well. We also did eye exams, lipid profile testing in terms of your cholesterol, your good cholesterol, your bad cholesterol, the whole 9 yards, Steve, and it went very well.
Okay, now we've gotten through the surface questions. It was a great event, 4,800 doctors here, but I've got you here in Detroit Wants to Know. One of the big issues that Wallet Hub identified in ranking Detroit dead last of the big cities was access to health care. Conrad Mallett of the DMC has done an amazing job of getting people signed up under the Affordable Health Care Act, going out to Coney Islands twice a week, and serving breakfast and getting people signed up. Dr. Joe, people still aren't using their health care, their health insurance, even though they have it, and some of them are not signing up. What are we going to do?
Well, we have to continue the course. That's the first thing. Thinking that in a year and a half of this historic bill being law now is going to get it, we never intended that. The boilerplate meetings to actually get this passed in Washington knew at the outset that there would be stages that would have to be conquered in order to get to where we need to be. This is just the first stage. And for people to try to judge this act at this point is like he's trying to decide who's going to win that baseball game today in the first inning. You better wait till the fat lady sings before it's over. So we're looking forward to the next stages of actually continuing to sign people up, continuing to educate not just the patients, but part of the problem with this, Steve, and this was expected, is that insurance companies don't understand the bill, hospitals don't understand it very well, doctors don't understand it, and patients are confused. So our job is to bring some clarity to this. We've got to be able to hit on all cylinders to make this work. Several of the Surgeon General's sessions were devoted to an assessment of the first year of the Affordable Care Act. How has it affected patients, hospitals, insurance companies, all payers, all the players in this?
We're going to take a break. I'm going to come back to that point right there, all right? Ladies and gentlemen, you're watching Detroit Wants to Know. Stick around. There's more with these Super Docs and Super RN. We'll be right back with Detroit Wants to Know. Welcome back to Detroit Wants to Know. I have Dr. Lonnie Joe, Velva Clark RN, and Dr. Jeffery C. Clark. Dr. Clark, let me just follow up on what Dr. Joe said in terms of the insurance companies not understanding this. I have a friend who's trying to get her life together, and she's got her Obamacare, but her insurance company, the doctor, is supposed to see her, but he's not seeing new patients. What's going on here?
Well, it's a very challenging problem. I think what Dr. Joe, to add to what he's saying, is that it's a process that's evolving, and some of this is a cultural change, not only with the physicians, but also with the patients. We do find in the community that frequently the patients are still using the emergency room as their main source of access to family practice sort of care. The other issues we need to get increased access by having more physicians in the community and increasing that access to those physicians. I do work at the Detroit Medical Center, and I was aware also of the progress that Mr. Mallett has made in getting patients signed up for this. But again, it's something that has to evolve, and I think that we need to continue to work on that.
Dr. Joe, also our knowledge about what ails us needs to grow. I mean, I know about sickle cell anemia, but what is this double negative thing you're talking about?
Triple negative breast cancer. It's
what in the world is that? I've never heard of it.
It's a very lethal form of breast cancer, and it occurs at a younger age, has a propensity for black women, and we have to thank and laud the leadership of Velva Clark as president of the auxiliary the past year that made this a topic and a force, and they're going to continue it. I know the new leadership coming in is going to continue to do the same thing to make people aware of this lethal form of breast cancer that has a propensity for black women in this country.
And
younger black women,
really?
That's correct. Yeah.
But you also said something else off camera, that heart disease is the leading killer of African American women. What were you saying?
Yes, heart disease is the #1 killer of African American women. A woman's chance of dying from heart disease is 3 times as it is of dying from breast cancer. A black woman's chance of dying from heart disease, 3 times.
3 times.
Mm-hmm.
How do we get this word out?
Well, we got to tell the story. One of the ways of doing it is exactly what Mrs. Clark was doing with the auxiliary. They had outreach to communities, but I'll let her tell the story.
Go ahead, tell us.
Well, what we tried to do was we have a health education component of our organization. And what we try to do is to go out into the community throughout the U.S. We have auxiliaries, and they put on educational programs talking about triple negative breast cancer and heart disease. And in addition to that, at this convention, we had a program for our youth, talked about health. We had a heart, symbol of a heart. We explained to them that in a play acting about the different chambers of the heart and how it works. And we also talked to them about exercise. We partnered with the Detroit Boys and Girls Club of Southeast Michigan, and we transported some of the children there from there. And we had a program that provided jump ropes and showed them how to exercise, because many of our kids are not out exercising, so we sent them all home with a jump rope. So we got to start with our children as well, teaching them about heart healthy diets and how you stay active. And triple negative, we talked about at our workshop because we did an outreach to the community, inviting them to come and participate in the program and to bring a friend. But I think we had about 83 people that in the outreach component that came in for breakfast, and they heard that from a physician what the triple negative breast cancer and heart disease is about. And we had actually had patients who were suffering from both diseases talk to them about their experience with heart disease and triple negative breast cancer.
Okay. Well, that sounds amazing. Dr. Joe, before you go, what was the overall economic impact to Detroit of these doctors coming here?
Unbelievable. First of all, Steve, this meeting was supposed to go to Chicago. In 2012, after a series of meetings, it was decided it was going to come to Detroit. And the compensatory groan was, oh boy, go to Detroit. Day one, when people arrived in this city, they were blown away in a positive manner by what they found in Detroit. And we're still counting the dollars and what it means to the city. They filled the restaurants. We sold out all the hotels. I mean, it's just been a blast. We've had probably the most successful convention we've had in 30 years as an organization here in Detroit.
That's awesome.
And people are leaving with a positive feeling about Detroit. And I told them to talk to everybody in their cities and let them know, don't believe what you see in print about Detroit.
Yeah, not all of it once you get out of downtown. We can talk about that some other day. To the 3 doctors, well, the 2 doctors and the super nurse, I want to thank you guys for coming on Detroit Wants to Know. I hope you keep getting the word out to the people about their health, because it affects the entire community.
Absolutely.
All right.
Yeah, thanks for having us.
Anytime.
Thank you.
Ladies and gentlemen, we'll be right back. We're going to switch gears from the dark and the medical to the quality of life and a group of people that have been providing an amazing, amazing event for us. We'll be right back.